Great. Welcome back, everyone, to House Healthcare. It is still March 15th in the morning, and we're back to our suicide prevention discussion. And this morning, we're going to focus on suicide prevention in the schools. So we have several people here from Agency of Education, which we don't have very often in healthcare. So thank you for coming. And then we have Department of Mental Health with us as well. So Heather Boucher, am I saying that correct? I hope
that is correct.
Okay, yes, great. So welcome, and I'm gonna look to you to start, if that works well. Great.
Sure. Thank you very much, Madam Chair. For the record, Dr. Heather Boucher, Deputy Secretary for the Agency of Education. Pleased to be here. It is true that we very seldomly as of late have had a chance to talk with you all and meet you. And I'm really pleased that this is occurring, just given the work that we've done collaboratively with the Department of Mental Health and the importance of this work and of the legislation that you're considering right now. I'd like to introduce as well Dr. Ann Bordonaro, who is our Division Director for Federal Support Programs, and Alicia Hanrahan, who is our Program Manager within that division. And they will actually be following me in a brief moment, and they will have some more detailed information, I think, to answer some of the questions. It is true, and I will say the reason we don't have written testimony ahead of time is that we simply we ran out of time a little bit. So I'm happy to codify what I will say and what we will say in some writing, if that would be useful to the committee after, and get
that would be great. Thank you.
Within the next 24 hours, certainly. So I'd first like to start by thanking the committee, as I alluded to, because all educators, including both everyone at the Agency of Education, and then certainly all of our educators from administration to all types of educator roles, clearly are concerned about suicidality, suicide prevention. As I think the committee knows from testimony that you've had, when a young person dies by suicide, it is devastating. It is devastating not only to the student themselves, of course, and the loss of the hope and promise for that individual, but it's also devastating, certainly, of course, for families, for friends, for schools, very devastating for schools. Most of our schools are pretty small in Vermont, and so it's often it can be a quite traumatic experience when that occurs, and then also for communities. So again, I want to thank the committee for their attention to this topic. We strongly support additional conversation and work together to make sure that we actually do a good job of preventing suicide, everything from suicidal ideation to actual completion. And of course, as we know, now through some recent data, both nationally and statewide, that this is an issue for all students that we need to be aware of and concerned about, but we have some pockets of student populations that we're particularly concerned about, and that are young women, as we know, and then also our students who identify as LGBTQ plus. We know that they're at particular risk for this suicidal ideation and death by suicide. And so we want to make sure that we stand behind the committee on the record for that. So I will jump in, and as I said, I will give some context about what we are doing, what is happening on the ground, and then I'll turn it over to Dr. Bordonaro and Ms. Hanrahan to fill in some of the blanks. And then we assume that the Department of Mental Health will then jump in after us, because we do a lot of this work, if not all of it, most of it together, hand in hand. And that's one of the things I'm most proud of in the past few years is the linkages we've built between our two agencies and departments. And we're really trying to model that kind of approach for the field. So to the extent that we're very linked at a state level in terms of crafting policy together, working together to address these challenges, we're trying to do, part of that is so that we actually do the best work that we can to actually stave off the ills that we're focused on, but then also we hope that we're actually modeling what that looks like for the local field, so that they actually feel supported in their partnerships and connections. So any questions about that high level before I jump in?
I don't think so.
Great. So the first one is a great question about what are the directives that come from any statute, State Board of Education rule, around suicide prevention. And I think what this is getting at is, in a nutshell, what are the have-tos and the shalls around suicide prevention for youth with respect to education? So we don't have many, if any, that are directly requiring the education system to do something about suicide prevention. In the past, we have had federal funding actually at the Agency of Education. So we've actually had staffing that has been able to really focus directly on that. But those federal funds have dried up over many years. However, I don't want to leave the impression that that means there's nothing happening in this space, because although there is no direct mandate that requires the local or state education system to be focused on this topic, of course we are, just given the centrality of the problem that I just talked about. So I wanted to talk about how suicide prevention efforts are embedded in a whole host of initiatives that we've been engaged in, some broader and some specific, and hopefully that will answer some of the questions that the committee might have. So first, we have been doing a lot of work at a state level and really both requiring and then also providing technical assistance to the local education agencies and their district or their DA designated agency partners with respect to social emotional learning, mental health, and wellness. And so in education, for a variety of reasons, we link social emotional learning, which comes from more of a developmental approach to emotion regulation, self-understanding, building strong connections with others, those kinds of topics. And then how that actually is linked to students' sense of overall wellness, including their mental health. So it's important for us to actually have made that connection, because you might not be aware, but still, and I think it became much more critical during the pandemic, you know, this is kind of a new area to have our classroom educators be responsible for mental health. They've always been and teaching about mental health. And so the way we think to do that is to actually link it to, and if we start with the preventative approaches of social emotional learning and making sure that from the youngest age, kids are actually getting supports for developing strong skills around this, that will actually stave off later mental health challenges. So that's the idea. And we're trying to do this because we don't want this to continue to be, well, you know, historically, this has not been education's purview. And so we're not, you know, we're not equipped. We don't want to do this. And we just leave it up to mental health providers. So I think this also speaks to, again, this kind of integrated system that we're trying to build. And most educators understand this, particularly I would say at the younger grades, because when kids are learning at all grades, actually, but certainly in the younger grades, they actually need to be coming from a place of developmental strength in terms of a whole child. So they know that you can't just have a child is not going to be ready to learn math and to learn literacy and reading unless a lot of these other types of skills have actually been addressed. And educators understand that. So the reason I'm saying this is because we actually built in as a state in our COVID recovery plan that would actually be a focus, so that social emotional learning, mental health, and wellness had to be a focus that was addressed by each district. So each local education agency to receive their substantial COVID funds had to identify in this bucket, which was just as important in our framework as academic, recovery, what they were going to do to assist students in making sure that they were building back strengths in social emotional learning skills, in mental health, in wellness that had been eroded, had been, some of this work certainly had been going on before the pandemic, but as we know, the pandemic really brought this to a much more intense head very quickly. And so we had to really act both statewide and locally. So I think, and embedded within that work, and I'll talk a little bit about some specifics, is a focus on suicide prevention and how to actually identify and manage that to some extent. And I'll talk a little bit about that. So one of the tools that we actually used our state dollars to invest in for COVID recovery is a platform called SELVT, so Social Emotional Learning Vermont. And I'm very happy to give the committee the link to that. It's right on our website. And this actually was designed for a variety of educators, classroom teachers for certain, but also educators in the support roles. It also is designed for parents and students. And so teachers can assign these topics from K through 12. There's a very sophisticated curricular plan to it in the sense that there are many, many lessons and that don't repeat from grade to grade. And there are definitely a focus on mental health and specifically suicide prevention, particularly in some of the later grades. So I think that's important to point out that some of those resources are readily available right now. And we have seen some pretty stable use of this platform. Definitely every time we kind of re-announce it, we see an uptick, and then, which is not uncommon. And then, I think teachers have actually pulled down what they needed, and then, they're kind of working with that. So I'm very happy to showcase that, have our contractors come and show you a little bit more about that if you'd like to see it.
That'd be great.
Yeah, we also have, and this has been great, actually. So I believe the session before last, the General Assembly directed the Agency of Education along with an identified wellness council that had, that the Secretary of Education appointed folks to. There were some parameters of who could be there. So it's a lot of health educators and at the post-secondary and secondary level. And so what the idea is to direct the Agency of Education to develop a model health and wellness policy for LEAs to use. And so we've been working really hard at that under the leadership of Jess DeCarolis, another one of our division directors. And that work has been primarily completed. Why? We're waiting to actually launch it because there has been some work this session on universal meals and on this work of this committee, for instance, that we wanted to make sure if there were any changes or anything we wanted to substantiate in statute, that it went into this local policy. But we'd be happy to also share a draft of that with the committee. Why I'm bringing this up is that for the vast majority of our sort of history in this wellness space, we were following requirements from our US DOE and, more importantly, our US Department of Agriculture, because the wellness was linked to our child nutrition efforts. And so we had to have a wellness policy that went along with our child nutrition funding. So we worked closely with our state agency of agriculture to do that. Well, flash forward several decades, we know that wellness is definitely including a focus on reducing obesity, a focus on physical activity, a focus on good eating, nutritionally valued eating, but it's become so much broader. And we really want to thank the committee or the General Assembly for requiring us to do that work. We supported it. And so we have included not only those kind of more traditional physical aspects of health and wellness, but a lot more in this domain that we're talking about. So in terms of mental health, broader concepts of emotional wellness, mindfulness, and then also suicide prevention. So very happy to bring that back and show the committee. And just to clarify, this would be a model policy that and we worked with the Vermont School Board Association as well. I don't want to forget mentioning them. And so this would be it's a model policy, meaning that this would be the assumption that each school board is going to adopt this wellness policy, which will also, again, be part of this broader piece at making sure that we're attending to wellness, including suicide prevention. Any questions about that?
I just have a broad question. As you talk about all of these programs, and I will say I have a son in Essex Westford, and so the social emotional learning is definitely embedded there. But is the requirement the same across all school districts, or is it you can do it if you want to?
So they were required to get their substantial ESSER COVID dollars. They were required to actually do a needs assessment on social emotional learning, mental health, and wellness of their students, and then develop what they were, interventions to actually address that. So we did not. So we required them. You have to assess where you are, and you have to actually identify the evidence-based strategies that you're going to use in this space. And so they all have to use evidence-based strategies as defined by the U.S. Department of Education. But welcome to our education system, which is that that is decided at the local level. So we have put some parameters in place, though. We're requiring them to do evidence-based interventions in this space. And that really is the edge of our regulatory authority, just as Title 16 is written. And Title 16 is education statute. Right. And we actually work. I don't want to give the impression that we're not working closely with them and not, giving them guidance. And if they have to get approved for these things to get the funding. And so we have a whole staff of folks that are experts in evidence-based strategies. And so, but I think it would be misleading to say that every supervisory district or school, even within the same supervisory district, is doing the same thing. I don't think we're there yet.
Okay, but they are doing something.
Yes.
That they deemed was appropriate for their situation.
That they deemed and then was approved by the Agency of Education.
Okay. And then what happens now that and actually, let me change my question. Are ESSER funds going away now? And what happens if they are?
Yes, they will be going away. They were, of course, meant to be emergency funds right. for addressing the impact of COVID, as we all know. We are actively thinking about that for many districts, and we just had a great passage of our local school budgets.
Okay.
I think only 2 did not pass, which has been unheard of recent. And so many of them, knowing that this is a long-standing, the challenges that underlie the mental health, wellness, suicide prevention challenges, the factors that underlie those are long-standing, and you can't be fixed in like a year to 3 years. They've really got to have a broader approach. And so knowing that, many of them are building those they're building in staffing, they're into their local school budgets. Okay. I don't know of many that have not addressed some kind of continuity for social, emotional, and wellness supports. I think one of the biggest things to note, though, that is the problem. The funding is not the problem so much. The funding is the workforce. So just like every other sector I know this committee has heard about in the medical field, nursing, we have a severe shortage of mental health professionals, which certainly my colleague Laurel Omland can speak more eloquently to than I can, but we also have a significant shortage in many of our areas, not all, of core teachers, educators, and then also support personnel. Okay. So we hasten to add that money is not the problem often. It's actually, money's good. So we want to make sure there is enough money, but money is not the most salient problem. It's actually the workforce. We had many of our local districts get approval and have great plans for addressing just the kinds of issues we're talking about, but they couldn't find a person to actually do that work. And so, so they sometimes had to amend their plan, advertise a little bit more broadly, those kinds of things. So I did want to certainly make sure I mentioned that.
All right, Heather, before you go on, we have one other question and then we'll let you continue. Heather, or Leslie?
Sorry, this is probably an impossible question. Is there a way to measure the emotional health of students in a school so that there could be targeted interventions in certain districts?
Yes, absolutely. And my colleagues will speak to that a little bit later, but that is absolutely a part of what we've been doing with a significant initiative called Project Aware, with 3 different districts to really model what a screening process, we call that a screening process, might look like. Many of our school districts and schools themselves adopted a universal screener for mental health and social emotional learning skills as part of their COVID funding. So one of the challenges we have, though, is that we don't have a good way right now of actually rolling that up to the state level. So that's the difficulty. A lot of that good data is actually being collected at the local level. We don't have a way to kind of look at that broad scale at this point. We would need some significant additional manpower in both of our agencies, both Department of Mental Health and the Agency of Education to do that. Although I think, it's not a bad thing to kind of think about moving forward in the future, because this is an issue that is not going away. We want to continue to work on this, but it's not, it's going to be a multi-year endeavor to make sure that our students are getting back to a place of strength and the promise that we know they hold. These patterns were actually occurring before COVID. We already had an increase in anxiety within Vermont for many of our students, particularly young women. So it's a good question.
I think there was a follow-up there.
Yeah, if I may. So I'm hearing you say that you don't have the data from the local level, but it would be a good thing to get. So is that a process that we should start thinking about, how to start so that we can address those issues? I'm just wondering what your thought is. How do we move on, I guess, would be my question, given where we are. I hear that you're saying we need more people in order to do that job. Is that job important enough to start a process about, I guess?
I think the devil's always in the details. So we'd be happy to start a conversation perhaps now with thinking forward to another session. I don't think we could get behind that this session. It would be a complex, comprehensive. We would want to recommend a comprehensive system for doing that. And so we'd be happy to continue working with the committee, but it wouldn't be something that we could support this session, just given the complexity of what we need to do.
How about next year as opposed to this? When you say the session, you mean 2 years or?
No. This year. Yeah. We'd be.
Something we could think about for next year?
I think so. Yeah. And, maybe we could work together, starting, over the summer, perhaps, if folks were willing to kind of sketch something out. I want to defer as well to Laurel, because I'm only speaking in terms of the funding constraints and parameters that we have in education. And I want to make sure that there's some space for Laurel to weigh in and speak about what that may or may not look like on DMH's side. It's a great question. And we are requiring, because they have to, so the LEAs have these evidence-based interventions, and they are required to document whether they're working or not. That's also part of the construct of the federal funding. It's just, again, that's happening at the local level, where ultimately that's where the rubber meets the road anyway. But we have not, and we're not alone, by the way. I don't know many states that have a robust system for, at a statewide level, actually looking at social emotional learning outcomes. I will say we, of course, have the YRBS,
Right.
which gets at this every other year. And so that's something we use routinely. But I think what we're discussing right now is something a little different. It's a little more comprehensive.
Yeah, that's what I'm thinking.
Yep. If I may, I don't want to, I know I'm kind of probably running out of time, but I just wanted to make a couple of notes about some of the other questions. And as I said, I'd like to give space for Alicia and Anne to kind of jump in. So we've already talked about how schools don't all do the same thing. They're locally created with some state parameters for quality control, funded through both state and local dollars at the moment. The question about the languages of education materials is really critical. And I just want to reassure the committee that for our communities that have had longstanding populations of students and families whose first language is not English, and many of our communities are experiencing an increase in that population, they are attuned to making sure and are required to making sure that the materials that are linked to funding, for instance, so the programs that are funded that through state and federal dollars actually are offered in the languages or services are offered to interpret, those documents for families. So it's something that we'd be happy to kind of look a little more deeply into. And interestingly, Dr. Bordenaro oversees our English language learner unit in the agency, so she can probably speak a little bit more to that as well. The other question about, are the programs different by age grade and level? Yes, most of what education does has a strong developmental framework. So, we certainly wouldn't and have not heard of a mismatch between what's actually being shared in terms of prevention and strategies with the developmental level of students. I think that's what that's getting in. I'm nodding my head because we have had a little bit of some parent concern about some of the questions that are not around suicide prevention, but around sexuality development, LGBTQ status, but that's not really relevant for our discussion today. And it's not, I would not say that's a widespread question either. So I think what I'll do now is actually turn it over to Anne and Alicia. I do have some feedback on a couple of the language considerations that are in part of the bill. And I'm happy to give our sort of perspective on that if you would like.
Why don't we hear from Anne and Alicia first, and then let's make sure we have time to circle back to that.
Yes,
that would be great.
That's perfect.
Okay, great.
Wonderful.
Great. Hello, everyone. It's great to be with you. I'm going to try to follow on without being duplicative of what Heather has just said, nor of what Alicia is about to say. For the record, I'm Dr. Ann Bordenaro. I'm the Division Director of Federal and Education Support Programs at the Agency of Ed. So child nutrition, what are called title programs, and then a number of other programs, including Project Aware, which Alicia will talk about in a second. And I know Laurel will have a lot more to say about as well. Since they're going to talk about that, I'm going to focus on other ways that we support SEL mental health and specifically suicide prevention that are not in the Project Aware realm. First of all, we have, you were asking about funding and the ESSER funding, the pandemic funding. There is regular funding that school districts get every year, the federal government, and we call that title funding. And many of those titles can be used for SEL mental health interventions, including suicide prevention. So it depends. Each one is slightly different. So Title II is about professional development for educators. So if a school has decided or a district has decided that that its staff need additional training in things such as restorative practices or suicide prevention or any number of things, social emotional learning strategies for students, they can, if they document that need, they can choose to use their Title II funding, some or all of it, for that purpose. And many of them do already. The idea is that teachers are supposed to be effective in instructing students so that students gain in academic achievement. And if you can make the link that, you know, teacher effectiveness and student performance is connected to some other issue, which Heather already spoke about, like anxiety or you know, absence or self-regulation or any number of things, then that's a justifiable expense. Similarly, Title I, which is our biggest federal program, and you may be familiar with it, is specifically focused on interventions to support students, eligible students. And I don't want to get into what that means in terms of eligibility, but all of our schools get some Title I funds. Some of them can use them for the entire school and all students and teachers in the school. And again, if they make the link between problems in student achievement and some social, emotional, mental health issue that's going on in their school that they've identified, they can again use those funds either for the teachers in terms of professional learning or for things like purchase of curriculum or consultation, hiring of additional counselors, hiring of a mental health clinician. All of those would be, you know, I could go through a huge list, but all of those kinds of interventions would be allowable if the connection is made to student achievement in their school or their district. Title IV is kind of a supplemental program, and one of the three, we call them buckets in Title IV specifically, is safe and healthy schools. The other two being technology and enrichment. So within the safe and healthy schools bucket, they must spend at least 15% of that allocation each year on activities related to safe and healthy schools and students. They can spend it as, you know, much more than that, but at least that much. Many of them are using their Title IV funds for things that we would connect to SEL mental health, like school counselors, mental health clinicians, restorative practices, training for teachers, youth mental health first aid training, which is specifically directed at suicide prevention, and a number of other things. Homeschool coordinators to build better relationships between, you know, students and schools and families. So, and in addition to that, each of these titles has a state level set aside where we hold some of the total allocation back and do activities across the entire state on behalf of the intents of that title. And so specifically in Title IV, back in 2019, we began the process of contracting with Vermont Care Partners, who are the SAMHSA authorized providers of training in youth and teen mental health first aid in Vermont. We did a contract with them, or we started the process to do a contract with them to provide this free of charge to all schools and students in the state. We went through with that. COVID hit, and so there were delays in their ability to actually get time with teachers and students to do the training, but they've been picking up the pace recently. And we're considering whether to extend that contract for another year or another 2 years. Schools can and do contract with youth mental health first aid with VCP all the time. But in order to make it easier for them, we thought we would just do a statewide contract so they would not have to go through that contracting process themselves. And I have a little bit of data from July of 21, when we really got started, through February of 23, our contract with Vermont Care Partners for this training has resulted in 411 staff from approximately 126 public schools, including CTE centers, school districts, approved or recognized independent schools, including therapeutic schools, and some folks from the Vermont Higher Ed Collaborative. They've all received the youth mental health first aid training. I say approximately 126 public schools because while we know the exact number of staff, some schools and school districts sent teams on more than one occasion. So there may be a little bit of duplication in the 126 number. In addition to that, there's a second program. Well, Youth Mental Health First Aid is a broad-based program, SAMHSA endorsed for suicide prevention. And it is directed at all staff in a school that have any connection to students. So it could be bus drivers, paraprofessionals, food service staff, teachers, therapists, administrators, everybody, anybody that might interact with a student. And it gives them a set of skills around how to recognize the signs of possible suicide ideation, how to respond in the moment in terms of talking to the student, where to direct them for additional services and supports. It's not meant to be a deep training. There's another one that that Alicia and Laura will talk about in a minute that we're also supporting, but this is meant to be broad-based to give everyone a certain toolkit or set of skills to recognize and help prevent suicide. There's a second component to the program called Teen Mental Health First Aid, where if a school has gone through the process of having at least several educators trained in the program, then for 10th to 12th graders in that school, the teens themselves can receive the same sort of training, but obviously modified for their developmental level, so that they can become peer, they can recognize among their peers possible signs of suicide ideation, know how to respond in the moment to them, where to reach out for additional support for those peers. And we've had 135 students from 9 public schools, CTE centers, or approved or recognized independent schools receive that training just in the last year and a half. So that's fabulous as well. Obviously, this is a drop in the bucket of students and staff in the state, but there continues to be demand for these services, especially now that schools are coming, so to speak, coming out of COVID a bit and have a little more breathing room to participate in professional development. And as I said, Vermont Care Partners is, I believe, applying again for another 5-year grant to SAMHSA to be the authorized provider in Vermont. And assuming that they get that that contract again, we will most likely be using some of our state level Title IV funds to enable schools to continue to access this this service free of charge. Last but not least, there's a couple of other things that are going on simultaneously other than Project Aware. We're about to roll out a Stronger Connections grant, which is something that came out of the Bipartisan Safer Communities Act. And this grant is built on Title IV. So any of the things that folks could have done or can do with Title IV, they can do with this additional grant that has a almost 4-year lifeline. We also have Act 112 that you all passed last year, and some of the LEAs that have won awards under that act are focused on, they're all focused in some aspect on SEL mental health, but some of them are focused more directly on suicide prevention. And we have community schools grants where also there's no limitation on not focusing on suicide prevention. I can't speak to how many actually do, but they could, certainly through, having counselors and other additions to their staff. So I think I'll stop there, take any questions, and then leave time for Alicia and Laurel to speak.
Great, thank you. I think what I'd like to do is let Alicia go, and then we'll take a break and answer some questions before. I want to make sure we give Laurel enough time too. So let's hear from everyone from AOE and then have some time for questions.
Good morning. So thank you for letting me come and speak to you today about Project Aware. My name is Alicia Hanrahan. I work for the Agency of Education as a education program manager and interagency coordinator. And I was kind of in on the inception of the writing of the grant for Project Aware with Laurel. So what I'd like to do is spend a few minutes just talking about what the grant actually is and give you some a little bit of feedback about what we've done and how we've done it and kind of where we're going from here. And I'd like to invite Laurel and Ann, if I miss something, please jump in. So back in 2018, we applied for the Project Aware, which is interestingly, it had to go to a state education agency instead of through a mental health agency. And it was an $8.5 million 5-year grant that we were awarded back in 2018 from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And so we put together this proposal and worked with or have worked with 3 different LEAs, which are supervisory unions. So we have 2 in Rutland County and 1 in Orleans County, where we have put some pieces in place. And I'm just going to kind of go with my notes here. In some of the pieces of the grant were certainly to promote mental health supports and services to kids and families in schools. We certainly wanted to, while Heather, alluded to the fact that we have a good partnership with mental health, at the state level, it's not as strong in some spots in Vermont with the local schools and the local mental health agencies. So that was a promotion that we certainly wanted to focus on during the 5 years of the grant. We also wanted to integrate mental health services into the schools. We wanted to take a look at, could we provide additional counseling? Could we provide additional school-based clinicians? What are some things that the schools needed to support their kids and families and their mental health? And interestingly enough, enter COVID, and here we are with, kids going remote, and we have kids who aren't able to access services, and really brought to the forefront, I guess you could say one of the sad benefits, I guess, of COVID was that we really, at the education realm, really noticed that kids were really suffering more than maybe we had once thought. So one of the great things about Project Aware is it brings in our supports and services that are already in place for kids through our multi-tiered system of support, and brings in the mental health services, and kind of looks at all kids, and looking at screening tools, and looking for kids who are needing additional supports and services who might have been on the radar prior to COVID, or have had kind of over the course of their lifetimes have had some supports and services. So what is it in addition that they might need? And then you've got, certainly pockets of kids who might never have been on our radar in the past. And what are some things that we can put in place? And these school districts have done an incredible job. There have certainly been bumps along the way. Lack of staffing for one. COVID kind of interrupted everything for a couple of years. We're looking at the possibility of a 6-year no-cost extension. The grant actually ends on September 30th of this year. And so what are we going to do working towards sustainability of providing additional supports and services to kids and families in our communities? One of the great things about this project is it was considered to be a pilot. And so what are the things that we have learned to move forward in supporting some kids? I think one of the great things about our recovery planning was that after COVID was that school districts had to put some mental health and some social emotional learning into their plans moving forward. Heather also mentioned earlier the lack of staffing in Vermont has been a huge issue, both educationally, but also mental health wise. Some schools have been able to partner with mental health professionals from their local designated agencies, and others have not. And that's been a very difficult situation, whether it's school-based clinicians, whether it's behavioral interventionists, whether it's school social workers, things like that. So that's been, it's been a positive and a negative, I think, having this grant. Certainly we've had suicide prevention has also been a huge piece of this, and we've partnered with a specific, I can't even think, it's CHL.
Center for Health and Learning.
Center for Health and Learning, thank you. I knew it was right there. So we partnered with them to do You Matter, which is a suicide prevention program. They've kind of modified it a little bit in the last few years. And so they've got components for schools, they've got components for students, they've got components for communities. So our 3 school districts have worked with them and certainly done some training on prevention, and have worked on kind of expanding that out. We started out with Project Aware, kind of working with one school in each district, and we've expanded that over the course of the 5 years. And then, so you go from suicide prevention for one school, and then you kind of move it along over the course of the time that the project has been in place. And so that has been a contract that we have done at our end. And so that doesn't come out of the school funding that they're getting through Project Aware, which has been nice. We've also had a family component, which is had its ups and downs. So, we've got some family representatives who have lived experience and can work with families and, talk about what are some supports and services that are available maybe at the school, but through their local designated agency. So kind of bringing those things together. And then, what about protocols for suicidality, and what does it look like in terms of the population of kids that we're looking at and who needs to be screened, and then what do we do with the data that we're receiving, and what are we doing to support the kids and families moving forward. We've also got an evaluation tool that's embedded into the grant, so we're working with a company who's able to provide us with a variety of data. They're talking with families, they're talking with staff members, and so we're at the tail end. So we've got another few months that we're able to kind of dig deep and see where we've been, where we're going, and what can we do kind of moving forward for sustainability. And that's kind of where we're at right now, working with all of our different partners in kind of figuring out. Anne mentioned that we've got some funding available through titles. And then just kind of figuring out where to go from here. So that's kind of where we are right at the moment. It's some really interesting work. I think COVID has made it kind of, for lack of a better word, kind of wonky, because we've had some really good pieces, and sometimes we've gone 3 steps forward and maybe half a step back or 2 steps back, depending on what it's been. And the workforce shortage has been difficult as well, but some of our schools have done a really great job moving forward and accessing services for kids.
Great, thank you for that. Laurel, did you have anything to add on Project Aware before we ask some questions in general to AOE?
Thank you, Chair. I'd be glad to. A couple of points. So for the record, my name is Laurel Onland. I'm the Director of the Child, Adolescent, Family Unit at the Department of Mental Health. Thank you for including me in the conversation today. I think Alicia and Anne and Heather covered this really well. I guess I would just highlight a couple of points with Project Aware. There was a focus, especially with the Center for Health and Learning as a partner, around do schools or districts have protocols, as Alicia talked about, for responding to students who identify concerns around mental health or suicide. And so I think that's an area that we want to continue to make sure that schools and districts do have that. We know that it's approached differently in each district is the sense that we got, because even within the 3 that we worked with, 2 of them had district level policies or protocols, and in another, it was an expectation that schools had their own. And so it's not clear, at least from the mental health side, of what is the oversight and ensuring that those are in place. I think we had, as Alicia mentioned, we had an evaluator who worked with us to design a survey of people who do any kind of mental health work within a school. And it was really interesting. Some of the results of that survey was, again, a small number of folks who responded, so we can't necessarily generalize this, but there was a range of awareness protocol that existed, or did they know it existed or not, and who actually implemented that protocol. So I think if there is consideration about having protocols in place, there also needs to be a step of communication of that to anyone who's in a school working with kids, whether they're school employed or contracted folks within the building, to understand what that protocol is and how do you follow it. So that's one, I think, learning that we've had from Project Aware. Another aspect, again, as Alicia mentioned, was we did a strong focus around enhancing the existing multi-tiered systems of supports with additional focus around mental health. And I think there's a framework that we've been using. It's called the Interconnected Systems Framework, but really the term of that isn't as essential as like the work that we've been doing across Agency of Ed and Department of Mental Health to infuse those concepts more strongly within the framework that Agency of Education has and is promoting to districts. One component of that is thinking about exactly the question that was asked by the committee earlier. How do we know how students are doing? And so the use of a universal screening tool can be really beneficial. And I think, again, lessons that we have taken from this experience under Project Aware, it's not just about picking a tool and doing it. There is many steps around effective implementation of universal screening, and it takes time. And I think because of the timeline of Project Aware, but also with COVID, there was this strong desire, especially from quite a few schools, to do this. And I really credit them in taking that on. And I think maybe it, for whatever it's worth, I think that there are some considerations around who's doing it, how is it communicated with families, who's part of selecting the tool, who's holding the data within the school. We had one school where one person had access to the data, and then when that person wasn't available, how do you gain access to that? Training workforce development around understanding the data that's coming out of a universal screening tool. And then a lot of support around not just students who might pop up with kind of high need. Of course, we need, again, that's where the protocols come in place. How do you respond to those needs with specific interventions? But thinking about the data that a universal screening tool can offer and how that can inform school or district's decisions within that multi-tiered system of supports. What are we doing for students, all students, based on what we're seeing from results of a universal screener? What are we doing for more targeted supports for students, and then the more intensive interventions? So there are some folks who are part of our system who really can understand that and are coaching schools. But I think that can't be lost, that even if we consider down the road universal screening, there needs to be some understanding of what is effective implementation of that. And then as Heather said, the data, even within the local, has some need to have focus around what's the data policy around that. But then there's the question of what, if any, aggregated type of data goes to the state level, and then how is that considered? I think those are the key things I would say. I do think there has been some good focus in providing awareness trainings, meaning mental health awareness, like youth mental health first aid, teen mental health first aid, and suicide prevention specific trainings through the You Matter curriculum. So those are two, I think, that go really well together. And that's when schools, I think there's interest in schools to receive those. It's a matter of capacity to be able to have staff attend those. I'll stop there. Thank you.
Thank you all very much for all of your work. I know we have some questions. I'm going to start and just ask one, and then we'll call on people. But one thing that I think we've missed in the conversation is what protocols are there across school districts, if there are any, when a death by suicide occurs of a student or a staff member?
I think I'll take a stab at it. So right now, I don't believe that there are any excuse me, I had a technical glitch. I don't believe there are any required protocols. I did want to mention that some of this work is happening under the auspices of the new violence prevention state director. Not so much that we would necessarily think of suicide prevention as violence prevention. We could have a conversation about that. But I know they're thinking about, as they develop protocols for safe and healthy schools, everything from nuts and bolts and hard safety to protocols. I think that this would be a good thing to actually raise with it's DBARBIC, because I think they are also starting to think about what are our levers for actually ensuring that we have some consistency across our LEAs. So to my knowledge, we don't have any requirement that would need to be developed. LEAs are doing their best by relying on their local partnerships with designated agencies, which many of them will immediately turn to pull counselors and support partners into the school. But I do think it's an area that, is not, there's a gap there right now. And I invite Anne or Alicia or Laurel to jump in.
I would just second what Heather said. One of the things we're learning is that from Project Aware and from our other work is that crisis response protocols across the board are a mixed bag. We don't have a state sort of template or a state requirement that I'm aware of, at least. So LEAs are at a lot of different places as far as kind of what Laurel just said. Their understanding of that, having the protocol, making sure that everybody understands what the protocol is, who's involved in designing it, who's involved in implementing it. So it is definitely an area where we need to do more work.
Okay. Thank you.
I just wanted to correct just a little bit, Anne. So we do have through the School Safety Center, we do have protocols in place for certain crises. So we have protocols in place for a school shooter scenario or an intruder. I just want to clarify that, but this is a different related or at least aligned space we're talking about. Sorry, Anne, just wanted to clarify that.
Heather, can you, while you still have can you define what an LEA is? I think that's
I'm sorry. So you can think of that as the school district. And we have been definitely riding a very deep wave of lingo today. And I apologize on behalf of all of us. So the LEA is the local education agency. And we contrast that with the SEA, which is the state education agency. These are federal terms that are bread and butter for us. The local education agency is basically, you can think of as the district, the school district. Technically in Vermont, it's a supervisory district or union, but just think of it in the vernacular as the school district. And then the state education agency is the AOE.
Great, thank you. All right, we have some questions, Alyssa, and then Brian.
I was interested, I understand that, you had kind of indicated that you're really constrained by local control, that Agency on Education, or I'm sorry, I don't even know your acronym. But I've been thinking about, we do have in statute harassment, hazing, bullying prevention services policies that all districts must have. And I'm wondering, if that might be something that we could consider regarding suicide prevention, and also how are districts, unions, supervisory unions doing with the current policy, which is in statute on bullying and prevention services for things like that. And do you see it also that we could kind of marry the two, suicide prevention with these other things?
Anne, do you want to jump in, or would you like me to?
Why don't you jump in on HHP? Yeah.
Sure. So yes, we currently do have statutory requirements regarding hazing, harassment, and bullying. Each school is required to have an identified person who is the HHB, I wouldn't say coordinator, and I forget the technical term, but they're the person that any HHB incident can be reported to by really anyone in the school. So it could be a student, it could be a parent, it could be a staff member. So every year we actually, through what's called an assurance survey, we get that information and it's posted on our website. So you can actually look on our website and see who are the identified HHB liaisons. Again, I'd have to go back and look at the technical term. Liaison and coordinator is not it, but I'm trying to think of what it would be. We do have a hazing, harassment, and bullying state council. I don't know that it's been as comprehensive as it might like to be in its approach, largely because of navigating through COVID. But I do think that is definitely a state lever to consider maybe hearing some feedback from the field on. Certainly, I think we hear anecdotally that there is a strong link between suicidal ideation, suicidal completion, and hazing, harassment, and bullying. So I understand where the logical idea might be to align those together. I'm just not sure. I mean, what we have in statute is what I've told you, which is, and there has to be a process, by the way, for investigating a hazing, harassment, and bullying complaint. That's what the role of that person that I identified at each school is. They lead the investigation. So I'd be happy to go back with our general counsel, actually take a look at that, what's currently on the books, and if we have any recommendations for how to better align that with suicide prevention, be happy to share that further with folks.
Are schools currently required to provide education around bullying and harassment, like on a yearly basis?
Well, it would be in the same vein that we're talking about with suicide prevention. So it is very likely happening. I don't think that I'd have to go back and look at the statute, and I don't know if Anne or Alicia, if you remember, sorry for the barking, but it would be embedded within some of those broader concepts around SEL, social emotional learning.
Okay, thank you.
Brian?
So I have a few questions, but before I read them, I want to just like frame them because I think it'll help you understand what I'm getting at. So like you talked about CAMS earlier, and for those who don't know, you may not know that I'm a clinician. I'm a clinical social worker, and I'm trained in CAMS. And in CAMS, one of the things we do is we look at the drivers of suicidality, and some of the common drivers, and I work with teenagers and children, some of the common drivers you kind of touched upon. And I want to list them and then ask you about some of the things you touched upon, because I think there might be ways we could support what you're doing or add to, like I might have some ideas, but I want to learn a little more about exactly what you're doing in some areas as it relates to these drivers. So some of the drivers that I thought of while you were talking were bullying, which was just mentioned, and like harm, like just being hurt by others, stigma and discrimination, rejection or exclusion, and grief and loss are some of the things that came to mind that kids are dealing with like more than ever, I think, these days. And some of the things that you're doing, or I heard social emotional learning, which I'm assuming is like emotional regulation skills development and like social skills and stuff like that. I see head nods, like more detail, but the gist. So it sounds like we're doing some skills development with kids in schools around managing their feelings and managing their relationships that could help mitigate those drivers. I heard restorative practices, but not details. So I want to know more about that. And then I am curious if you could also speak to how you might be taking like a trauma-informed approach in the schools, and how harm reduction philosophy might be used. And I think that this is the one where maybe the least is done, because harm reduction is often like used to treat like substance use, but it actually can be used for any risky behavior with adolescents. Like it could be used to like reduce video game time if it's like interfering with someone's functioning, for example, So I'm curious like about how harm reduction might be currently used, or how it might be expanded, because I think if kids were educated like to be more aware of the harm they cause to themselves and others in general through their choices, then they would probably harm each other, and we would harm each other and ourselves less, when we become more aware of it. And that fits into the social. So I wanted to kind of paint the picture and then let you kind of speak so you see what I'm getting at. And what I'm really looking for is maybe some more details about what is being done, and like how consistent it is around the state, or is it very are all school districts using restorative practices? Are there some who are like doing it in an exemplary fashion and others who are like doing the opposite? I don't know. You don't have to name names of the school districts, and because I'm not trying to make anyone look bad, just trying to understand like the scale and scope of these things. And then I'll let you answer. I had a more specific, maybe I'll just put this out there and then I can just listen. The last thing was that parents have you said parents have, someone said, I think it was Heather possibly, said parents have concerns about some of the questions in social emotional learning around identity. And I don't think any harm was meant when you said like it's not relevant right now, but they're around LGBTQ issues. But I actually think that's really relevant because LGBTQ youth have a higher rate of suicide and mental health challenges because of the stigma and discrimination. And so I was just hoping maybe you could talk a little bit more about what the parents' concerns are and how you navigate that so that kids are like, I don't know, growing the healthiest way. So yeah, thank you.
Can I just identify that one really quick and then respond to that really specific one, because I understand I wasn't clear in what I was trying to communicate. So I want to clarify that. So we have had maybe 2 complaints that have come to the Agency of Education that say, why are you asking my student on the YRBS about what their gender identity is, what their sexual orientation is? And so that's why I agree. It's part of a broader construct of how we are actually, as a society, including families, communicating about students' autonomy and identity development. So I just meant that, and I agree, like that is certainly part of, if you've got a parent at home that's not supporting you, that's going to be certainly a stressor for an LGBTQ plus youth. So I want to clarify that. What I meant is that having the issue around the items on the YRBS is not quite part of our conversation today. That's all I meant, that like they're taking issue with the actual questions on a survey. So I want to clarify that, which I think would be beyond the scope of what we're trying to talk about today. Does that clarify? Because I definitely agree with you that that's part of a broader construct that we would be trying to actually address and provide supports for such students. The other thing I wanted to just jump in before I'll let Anne, Alicia, and Laurel is I forgot to mention PBIS, which is Positive Behavior Intervention and Supports, which is not mandatory across our state, but we have a huge state contract that supports this. Some of our Success Beyond 6 funding is predicated on that, which Laurel can speak to. And that's where a lot of those universal practices of like, how do you be a good human being with each other, respect each other, take care of each other, support each other. That's where a lot of that is happening in PBIS, which is widespread across our state.
And I think I can jump in with a little bit of information about a couple of the questions you asked. And I'm glad you asked them because they're really important. So we don't have any requirements from the agency that folks use, for example, restorative practices. On the other hand, we strongly encourage it. We mention it in many different venues in our work with schools on all different teams. And in fact, we know that a lot of, I'm focused on federal funds, but a lot of folks' federal funds are used to support restorative practices training for teachers and other staff. We also have another grant, and Heather, I don't know enough about the one that Meg we just got that Meg's administering, but I know that's about restorative practices. And we use Title IV state level to fund a major 2-year effort statewide on providing restorative practices training to all LEAs that choose to take advantage of that. So again, they're not required, but we're making it available at no cost. So there is growing commitment to that, both we see in local education agency budgets and also in terms of our state level spending from the agency. The same goes with trauma-informed practices. I think that's a little bit less widespread because what goes by the definition of trauma-informed practices is not quite as clear cut, and a lot of, for example, professional development providers claim to be providing trauma-informed practices and aren't necessarily, or what does that really mean? We only have a few folks in the state that we're really confident in their training capabilities in trauma-informed practices, and they're pretty tapped out. But to the extent that we can refer school districts to them, and we have done so many times. And Alicia, you can say more about that if you want. I know, and Laurel, we're talking about Dave Melnick and others. The other is in terms of harm reduction. while we have a substance abuse and tobacco and substance abuse prevention grant program, competitive grant program that we've had for years, funded with the tobacco settlement funds. And one thing that we've really done over the years is move away from focusing on substance abuse and use in the grant, and focusing much more on skills related to self-advocacy and harm reduction. And also, so if you get one of these grants, and I don't remember offhand how many LEAs have them, I think it's around 15 maybe, but the requirements within that grant to use certain professional development models and curricula are very much focused on harm reduction, as opposed to here's what drugs do, here's what they do to your body, you know, the old kind of approach that most people think of when they think of substance abuse prevention. So it's much more of a sort of social work, skills-based self-advocacy, self-regulation, self-awareness kind of approach, so that you don't do a whole bunch of harmful things, including using substances. So I'll stop there.
Great, thank you. Alicia, did you have anything, or Laurel, anything to add?
I just have one quick thing to add with Project Aware. We did add kind of at the beginning of Project Aware, we added Up for Learning is the company name, and it's about student self-advocacy and having students looking at data that comes from the Youth Risk Behavior Survey that Heather was mentioning, and taking a look at what's going on in their particular schools, and then working with Up for Learning and working with a staff mentor at the school, and kind of what are some things that are happening in our school, what are some things that we can do to prevent it, kind of developing a plan and moving forward. So there's that piece, and then there's also kind of a self-advocacy kind of component to it as well, which has been pretty successful. And there, Up for Learning has also been involved with the substance abuse and tobacco grant that Anne was just mentioning as well. There's several supervisory unions who use that component too.
Great, you good, Ben?
I do have it's sort of like a final questions, like, because we're hearing the testimony because we're looking at what else we can do to prevent suicide. But I'm thinking of it that to prevent suicide, we want to reduce suffering for people in general, so they don't get to that point, and build skills, like you said. And two things that stood out with a restorative, from what your response just now, was that there is inconsistent use of restorative practices and some incentives in place to use it, but no requirements. How would you feel, or what do you think about if we found a way to explore, I don't want to say requirements, but explore the possibility of, so it's we have incentives and then we have requirements. We can make people do something, whatever. And if the incentive isn't working, then is there a way to kind of softly move towards a requirement, or is there something we can do to make the incentive more appealing, for people to try restorative practices? So I guess the question is, in this bill, is there something we could do to support what you're doing around restorative practices, and to expand the use of restorative practices in the prevention of suicide? And then the second thing would be with harm reduction, the same question. Is there something we could do in this bill, maybe a pilot project, maybe funding, maybe a requirement, or some way to strengthen the incentives so that we can explore use of harm reduction philosophy, to reduce harm to self and others and prevent suicide? And
if you don't mind, I'm going to broaden the question a little bit, because we talked a little bit about this yesterday with Department of Mental Health. So everyone is doing amazing work. You're all the local school districts are doing really hard work. There are so many different players within mental health in the state that are doing amazing work. But as we said yesterday to DMH, we feel like everything is scattered. And it is here too, because of the local control of the school districts. And so one of the things we've been talking with DMH about is, there needs to be a strategic plan around suicide prevention, mental health, and wellness. And so there is now a director of suicide prevention within DMH, and we're going to work towards that with them. And we may put something in legislation to help guide them to that end goal. So generally speaking, because we don't work with AOE very much, how does that work with you all? There's the bullying harassment title statute, talked about integrating suicide prevention and that. Just, talk to us a little bit about how that would work with Agency of Education.
I'll take a stab at that. So the other, and this is just such a rich conversation. I want to thank the committee for inviting us all. I think one of the challenges from where we sit is that we don't have a real strong sense of, and I agree with you, Madam Chair, sort of the holistic canvas of what things look like. So we actually have bits and pieces, anecdote, and then where we are required and have the resources to collect information, we have it on that. And so I actually think that to really solve this, we need to take a step back and get that sort of holistic depiction of what's really happening statewide. And often what we would do in our agency is, commission a contractor to actually do a study on that, which is not often the most positive perspective, but it really works from our perspective because it gives you the data you need to actually then develop what is the exact intervention from a state perspective that's needed. So for instance, we've just talked about how we know of all these different, you can think of it sort of like as popcorn kernels that are happening in a lot of areas around. We know that it's not happening in a robust fashion. And because of local control, I would agree, folks are picking and choosing. I don't necessarily know that that means that that what they're picking and choosing is bad. They just might be picking different things, but we don't have that are just as effective. We just don't have a way right now of actually understanding, other than I would say anecdotal information, what does it really look like on the ground? And so that would be something that I would recommend we think about actually starting at step one, which is like, how do we get a better depiction of this? We can certainly do our part on the agency side about putting together a more robust, integrated picture of all the different things we're doing in this space, but that's still not going to really give us what we need in terms of what's happening at the local level.
Thank you. So we have a couple of questions. Can you just
Yeah.
Topper?
Thanks, Madam Chair. Thanks for the testimony. I learned a lot from the testimony, but the one thing that I don't understand is how is all of this good work that you talked about, how is that being presented to the students on a day-to-day basis?
I can take a stab at that. I think you might also want to hear testimony, Madam Chair and committee, from entities that would represent like the superintendents and would represent the principals in terms of what on the ground this looks like. So our role is really to set the state standards, assist in terms of technically like what is going on at the local level, monitor that to the extent that we have authority to do so, and keep track of that. So I don't, I can give you again more anecdote about what that looks like from particular places, but I think getting additional testimony, and I also look to my colleagues here who have much more, I would say, on the ground experience at the moment than I do in some of this world. I think it would be important to actually hear exactly from the folks that would actually be in charge of doing any new work in this area. So there I'm talking about what would that look like to hear from superintendents, to hear from the Principals Association, even to hear from the special education directors, because that's where a lot of this stuff is housed in some districts, not all. So I don't know, Anne, Alicia, Laurel, do you want to give some examples of what this work might look like on the ground and how it's communicated? I think it varies from district to district.
Yeah, we don't hear from students directly at the agency, which is frustrating. It would be wonderful if you all on the committee could actually, through the avenues that Heather just mentioned, maybe actually hear from students in some schools. But we do know that a number of the initiatives that we've mentioned and some that we didn't, I was just looking back at some documentation that Ian Burfoot, our health coordinator, put together, involve student groups. So some of those student groups are self-designed student groups, like Outright Vermont groups in different school districts, for example. Others of them are groups put together by, by these programs, like the Up for Learning group that was, facilitated by the contracted vendor that we use through Project Aware. What the actual experience of students is in those groups, I think we could direct you to places where you could identify students who you then could pull in to ask. I'm not sure that we know too well. Laurel and Alicia, in Project Aware, did we actually have any student interviews as part of the West Ed evaluation? It's not ringing a bell.
Family interviews only.
Yeah, I think so.
I guess I would also just offer, how does this translate to students on a day-to-day basis? I think it's translated in school climate. It's translated in the interactions they have with people in the school building. When they might become dysregulated, how is an educator responding to that? How are they responding to multiple students who are dysregulated within a classroom? I think that's what we're really trying to get at. And then it's also, how are the educators experiencing this, and are they feeling supported and skilled and confident in being able to manage what they're experiencing? So I think that's really, those two are really key, and that's the ultimate outcomes we want to see, is educators and students are responded to effectively and their needs are met. I'm not sure if that gets at the
You really,
question.
correct me if I'm wrong, so you really don't know.
Well, I don't think we have the right
All of
people.
I'm not sure we know at the state level as well
We give out the
as
grants.
perhaps.
Go ahead.
Pardon. I apologize. Some schools do conduct climate surveys, and so they have an understanding from students directly about what is their experience within school. We don't have data at the state level about this. Within DMH, we have data, as I think I've testified before, on students who are receiving mental health services under Success Beyond 6 and strengths and needs of those students. But that's a limited population compared to the whole statewide student population.
And just to build on what you said, Laurel, and I think it loops back to something that Heather said in the very beginning, we do have information at the local level. Almost all schools are doing some sort of self-assessment climate survey, looking at their YRBS. They're looking at lots of different kinds of data. They also have their lived experience in terms of, student incidents and parent communications and, student complaints and, bullying and harassment complaints and all kinds of different sources of data. And we ask them to consult that data when they plan investments of different funds, for example. That's a requirement. It's not an option. So we are seeing anecdotally through their applications for different funds what data sources they're using and what they're concluding from those data sources. But we don't have a statewide vehicle right now other than YRBS for sort of aggregating all of that up to the state level. And I think you said in the beginning, Heather, that we're not averse to that. We've talked about that, but it would need a lot more thought and probably, some work together over the summer to look at, there's capacity issues, there's confidentiality issues, there's a whole bunch of issues, and we'd have to look at what would a good system of gathering that kind of data at the state level look like, what would be necessary to bring it into being, and what would we do with it if we had it. There's a lot. It's not that there is no information, it's that the information isn't necessarily at a state level in an actionable form other than YRBS. So we're certainly open to working toward that in consultation with you all, but we don't have a concrete thing where we could just say, if we do this tomorrow, we'll solve this problem.
And I'll just add, as we've been sitting here, my son just texted me that he just completed the YBRS survey in school. And he's done another one, DESSR or DSSA or something. But what's interesting, when I ask him, well, what's come of it? There's no follow-up within the school, right? So to your point, how is it translated back to the kids? He's taking these surveys, but what's it really mean to him, right? So it's a really good point. Daisy?
Thanks to Laurel for mentioning, I think, around this topic that it is very much about the climate change. And I know I go into my kids' school often. I'm part of a project with Up for Learning, actually, and am always really impressed and almost enamored with the work they do. And it's all very student-led and incredibly innovative. And I'm just excited to hear about the way that this work is being delivered, because when I was in school, it was, go to the nurse's office and talk to somebody if you're stressed out. But there are, multiple ways that I think we're supporting students. And my question is, how are we supporting the teachers? I think about, all of these educational ways that we're improving protective factors, but really, we all know how exhausted our teachers are. And when I go into a classroom, I can instantly tell how a teacher's feeling. And I haven't really heard us talk much about what we're doing to support them. And I think it's about more than just, I don't want to talk about salaries or anything, but what resources and tools are we doing for them that doesn't require sending them to a training? Can you tell us about that?
Yeah. So we are currently in procurement for the other part of Act 112 that came through the General Assembly, which is actually providing statewide mental health and wellness supports for our educators, because we also understand certainly that they need to be, just as we're talking today about how our students need to be well-grounded, need to feel good about themselves, so do teachers. And going through this pandemic has been really, really tough on our educators. So I can't talk much about it because we're in the procurement process, but we were charged by the General Assembly to actually use part of our COVID set-aside dollars to actually fund a statewide program, if you will, that will provide just-in-time mental health supports for educators. So once we have that contract process in place, we'd be happy to talk about what that will be. I do apologize. I am so sorry, Madam Chair. I actually am being called away. So I need to actually step out, and I apologize for that.
That's okay. If you could provide a written response on some of the language in 283, specifically around student IDs and the 988 line, that would be very helpful.
Perfect. I will absolutely do so.
Great.
Within the
thank
next
you.
24
Thanks.
hours. Is that an okay timeline within the next 24 hours?
Yes, we would need it by this time tomorrow. That would be great.
Okay. Yeah. Perfect.
Wonderful.
Okay.
Thank you very much
Thank
for
you all
being
so
here.
very much.
Thanks. Art, I think you still had, can everyone else stay for a couple minutes? Okay. Art, you had a question?
I'm going to hold off.
Okay.
Yeah.
Okay, great. Brian.
Yeah. So, I appreciate the back and forth, I asked a question, you said something, and then I'm asking, and then because I have another question based on your feedback. We heard, and Heather left, and so Heather might have been the main person saying this, but it's okay that we heard that there. And I think Chair also talked about how it's siloed and we don't have a good understanding of what's happening where. It sounds like some places are doing some things really well and it may be working, but others may not be doing stuff or may not know how well it can work. And I heard that I think the exact words were take a step back and look at things before we start doing too much. So might it be useful to look at some kind of study? And I know we study things a lot, so I'm very hesitant these days, but in this case, I can see the benefit if it was a different kind of study. Which would there be a benefit to doing a study or a review of studies that we've done, and pulling everything together around the use of evidence-based approaches that could prevent suicide, not only in the school systems, but in other systems of the state, like looking at what the school systems are doing, looking at what's happening across the healthcare system, but then I'm also thinking the criminal justice system, because those three systems intersect a lot, people's lives. And so I'm just wondering, might there be a benefit to doing some kind of study or review of the studies we've done so that we can kind of get a picture of what's happening where and what are the success stories? Because I think then we would understand, first of all, better, but then also the people would understand, communities would understand. They could look to what's working in other places. It would be a way to get people on the same page. And then I think next year we could talk about where do we need to direct resources and funding to support work or training, et cetera. But I'm just curious, would a study, and this is why maybe we can ask Heather later too, would it be a study on the use of evidence-based approaches to suicide prevention? So kind of a broad, not naming every little thing in it, or maybe giving some examples, saying including but not limited to, and then listing some things to look at. Would that be helpful for us to do in this legislation?
I don't know if Anne or Alicia, if you want to respond, or if we should direct that question to Heather.
I think Laurel may have input here. I'd like to direct to Heather. What I would say is that there is a lot of research about suicide prevention approaches. And in fact, on so many of these issues, there's often too much research and it's hard to make sense of it and kind of digest it and use it. And so if we did have a study, it wouldn't be so much that we would be needing to find those, as the contractor presumably would need to make use of the existing resources like SAMHSA and other resources to find information that is useful to schools and criminal justice organizations and however broadly you directed the study. And kind of summarize that for folks. Because as I said, I think a lot of the research is out there. What isn't out there is the capacity to ingest and digest it all at the teacher and principal and school district and even state level, at least not at the AOE right now with the resources that we have. So it could be helpful in that regard, I guess.
Thank you. Laurel, did you have anything to add?
I think I would also defer to Deputy Secretary Boucher. Part of what I thought I heard her talk about was getting a better understanding of what is happening in different districts around the topic of anything from the universal screening to what practices are they using. But I would want to do more thought and hear from her what she was thinking about that.
Great.
So maybe, go ahead.
I was just going to say that's a really good point, and I think she was kind of taking it in that direction, which is a little bit different than I heard you taking it. And so we would want to get clarity on what is it a study of? Is it on practice in Vermont? Is it on quality of implementation of those practices in Vermont? Or is it a study of sort of, evidence-based best practices? Those are very different studies.
And I think what I was suggesting was a little different than what she said, because what I was getting at is I think we should look at what the school districts are doing, but we were talking about how things are too siloed. I actually think we also need to look at what's happening in regions in the healthcare system and in the criminal justice system and how it intersects. And so we can ask her and get her feedback, and we might want to ask other stakeholders about that too. At the very least though, if we could do, it sounds like if we could support some kind of study to identify what's happening locally and an assessment of what's going on, that would be good to make decisions where to invest in the future. There were two other ideas based on what you said I want to just throw out there. We were talking about student perspective and how there's not a lot of ways to gather direct student perspective in this discussion right now. And it just made me think, might there be a benefit over the next year for the state to do some kind of engagement with students. Like, and when I say the state, I don't know if that means the legislature or the AOE or some combination where we like listening sessions or town halls or something where we create a space for to say to students, we know this is a problem for you. Like, and we're here to hear about it and to hear what works and doesn't work for you. And I don't know if there's like a space for that in this work around suicide prevention, just having these like community, because I know like in postvention, a lot of it is about bringing the community together and reminding us of the relationships we have that are still here after we lose someone. And so, you know, there just might be something healing coming out of the pandemic to do something like this so I don't know what your thoughts are about an approach to that, you know, like some way to get engage students in like a positive way in addressing this problem. I don't know if it would be like if you think like based on your experience, if there's a way we would do that, like town hall format or, you know, would you say, oh, these days kids won't come to a town hall. You have to create a TikTok trend and then you'll get input, you know, like, I don't know, like, what are your thoughts on, you know, on that? If we could fund or do something like that as part of this bill to get more.
Laurel or Ann, and then we're going to have to wrap it up.
Yeah, I might recognize that there is a newly created youth council that perhaps could be an option for that. Can I go back to something that I didn't have a chance to add much earlier in our discussion about the postvention?
Yes.
That is a component of developing effective protocols, that there is planning around postvention supports. So Center for Health and Learning, when they go through a more intensive UMatter process with schools, can help them review their protocols and update, strengthen those, including the postvention components of it. So I wanted to note that it is a recognized essential part of suicide prevention, and that there can be a structure. Center for Health and Learning does have a template around what those protocols can look like, and then work with schools to really tailor it to their
Okay,
setting.
great. Thank you. And Laura, I apologize if there was additional testimony you were going to provide that we have now run out of time for, but we appreciate you putting it in writing so we all have that. Ann, did you have something else to say?
I was just going to say that I would direct to Deputy Secretary Boucher the question of, you know, whether we want to assemble any groups. I suspect that her answer will be that the agency doesn't really have the capacity to like assemble groups. But if you all wanted to do so, and it makes a lot of sense to inform your own decision making as legislators, we could certainly direct you to a lot of different student groups that are supported and funded directly or indirectly through a lot of the initiatives that we're doing at the agency or that we are aware of. And so we could direct you to those organizations so that you could reach out, or whomever you might contract with to do this could reach out to them to, you know, create those groups, invite students and all. We have lots of groups, lots of schools that we could connect you to connect with students.
Great. Thank you very much. And again, thank you all for all your work here today with us, for spending the time, and for